Good afternoon. I am Dr. Tanvir from Dentum, Vasant, Vihar. I am a senior orthodontist and I have my own private practice along with my wife, Dr. Gunita, at Dentum, which is our brand. And we are based out of various locations, mainly at Vasant Vihar, the Chhatarpur Farms, and Anand Niketan. Besides that, me and my wife are both senior consultants at the Sir Gangaram Hospital and the Holy Family Hospital. Well, that's a little brief about me and our brand. And my branch, which is Orthodontics, and as everybody knows, and it's a parent and a child's dream that as soon as the child turns 11, 12, everybody and anybody is only talking about braces when it comes to dentistry per se. So the first thing is to get the children to come over to the center and have their checkup so that they can be aligned to get an orthodontic consultation with us. And what is so children come very excited because they've seen these beautiful colored braces, and these days there are butterfly shaped braces, there are golden colored braces, there are invisible braces, and of course the latest adjunct to the field of orthodontics, which is clear transparent aligners, which has become a real mainstay, especially at the time of COVID, because this was one treatment in which one did not actually require to come to the orthodontic office so often, and one could just continue the treatment in the comfort of your own house. So it, of course, is a revolution in the field of orthodontics when we talk about aligners. And once the parents and the children come over and they are super excited, the major question that pops up in the mind of each and every parent, child, or some of the parents who have already gone and visited other dental surgeons is, are you going to remove any of my teeth? As in, is my case warranted for extraction, or are you going to do a totally non-extraction orthodontic treatment? That is become the mainstay, the focus, and the demand of every individual child and especially their parents when they come to seek an orthodontic advice, an orthodontic consult. So let me come to this, that why do we need to do extraction? You know, when a patient comes to us and the patient only says, sir, just put my wires. Why do we do so many diagnostics? We take x-rays, we take their photographs, the photographs from various angles of the face, the intraoral photographs in which we put a cheek retractor, and we take photographs of the front view, the right and the left views, and then we, all eyes are on us, and the question is asked, are you going to extract? So coming to this, what was the need, or why do I need to extract in an orthodontic case? The foremost reason and the very logical scientific reason is the need of space. I need to take the teeth back from their position. Where do I take them? I need to extract the premolars, and of course now there are various extraction options, but the usual protocol and what was being followed from donkey's years is that any patient who would walk into an orthodontic office would be told, son, daughter, you require upper and lower extractions, and the next thing is that we will put your braces. So even if the teeth are not in a straight line, they are malaligned, and we need to give any kinds of braces, may it be the transparent, may it be the metal braces. The question is only one, that if I need space Where do I get my space from? I am in no other option than to suggest to the patient, I need to extract. Second thing, and a very, very important thing, is that parents and children who do not understand these logics of pushing the teeth back or alignment, they are only interested in one thing, and that is what would be the change in my profile when I do extraction. And that is why extraction was the mainstay, that as soon as the teeth get back, or in our terms get retracted from their proclined position, automatically we get a straight profile. From what is a convex profile, or a profile in which there are short upper lips and the lips do not meet, the teeth are protruding or proclining through the lips. Once we extract and take the teeth back, we actually get a very, very aesthetically pleasing profile. So this was one of the major reasons that whenever we decided that we need to institute orthodontic treatment, we would also suggest that please get the extractions done. As time passed, as we now know that our dental age has become quite less as compared to the chronologic age, and the time to start braces more or less has been reduced to as low as 9.5 to 10 years, because we are seeing patients that at the age of 10 they have a complete set of permanent teeth. So orthodontic treatment has to be instituted as early as 10. Now, when at the age of 10 you come to the orthodontic office, you have two or three major advantages. Number one, it's like catch them young. You are very young, and to start a treatment which would take 1.5 years, or even 2 years from that thing, from the time you get it started, it's good enough time before you actually come into your major board, etc. classes where there is too much stress of studies. Secondly, and the foremost thing is that when your bone is so soft, it is very easy to move your teeth. And thirdly, the main advantage is expansion. So we can start doing expansions and we delude the need for extraction. Now, what are the advantages that if I were to institute a non-extraction treatment, apart from the feel-good factor, the overjoyous factor, and the aura of telling my friends that, oh, my orthodontist does not extract. I got my treatment done and we never did extraction. That's a major kick when it comes to discussing. But the overall scientific advantage of non-extraction treatment is that with the help of modern technology coming these days, both skeletal as well as dental changes can be done without extraction. So the point is, yes, I can do your treatment without extraction. I don't have to raise my hands and say, sorry, I have to extract. Secondly, the fear factor that the child comes into us and we, the pressure of getting a local anesthetic put and then an extraction. Children sometimes take as much as 2.5 weeks to even mull over it and then come to this conclusion. Okay, we will go for extraction, and the so-called Rona Dhona in the clinic. So it is totally non or atraumatic to the child and his family. Secondly, well, if I have the know-how and I can do the expansion, I can get all the teeth aligned without extraction, it's easier for me to treat. And another thing is that a non-extraction treatment is completed in a much lesser duration as compared to an extraction case. So I would easily complete a non-extraction case in 9 to 10 months. Some of my patients and their parents are surprised and they say, Doc, you finished the treatment so fast. Well, the reason is I did not extract. I don't have to close the extraction spaces which are left even after alignment, which takes very, very good time. So as compared to a extraction case, my non-extraction treatment is at least 6 months shorter than my non-extraction treatment. Now, the if I look at it from this point of view, these are certain advantages of non-extraction. And what would be a disadvantage when it comes to extraction? So, like I said, as we compare it with that, this is time consuming. Secondly, there are certain children who then decide that they will not do the orthodontic treatment just because of the fear of extraction. So all those patients who have deliberately chosen to ignore their bite, deliberately chosen not to get well-aligned teeth for the only reason of extraction, then do not do their treatment, and as a result, in their adulthood, they face XYZ, bite, malocclusion, aesthetics issues all their life. Another thing that whenever we do extraction, we as orthodontists tend to use much higher force values as compared to non-extraction. Therefore, we are dealing with a little bit of less patient compliance. We are dealing with uh, pressure. We are dealing with little anti-inflammatories. We are dealing with certain painkillers, and getting the child to a normal situation post extraction takes a good 3 months time. And of course, another very important thing is the oral hygiene, that when we have a case in which we've done extraction, there is umpteen number of food getting stuck in those extraction pockets. Sometimes the child faces gingivitis. Well, I would not say that this is a complete disadvantage. If the child is not observing good oral hygiene protocols in a non-extraction therapy, still the child can have gingivitis. So these are certain extraction versus non-extraction. One of my favorites, and I have been trying from the last 12 to 13 years to try, do as many of my orthodontic patients non-extraction. And well, the success rate is quite high. I would say as much as 90 to 95%. There have been hardly any patients in which I have had to suggest to them that, well, we've tried, but now we need to extract. And I make it very clear with a proper consent that we will start non-extraction, but if at a time we feel that you need to extract, then you have to be mentally prepared. In hardly any cases. It could be just one case, probably in the entire 1.5 years of the same batch undergoing orthodontic treatment. Now, certain questions and certain things which I would like to talk to you. Uh, so, if there is non-extraction, what are the new systems that we are doing? Well, we are doing the self-ligating systems, and the self-ligating or the frictionless system may it be of any company. Uh, I am not a brand ambassador of Mercedes Benz, that I will only promote Mercedes. I would like to promote a technology. The technology is self ligation. Self ligation means that you are not actually binding the bracket with the rubber bands, creating extra friction, creating a situation in which the forces are too high. When you have self ligation, you have locks, there is free sliding, and that is one of the major methods of doing expansion, and especially Second, answering the second question also, that if we can do the self-ligation system as early as 10 and a half years, our success rate is 100%. There is no going back on the situation that I will need to extract. Now coming to this, that yes, we can do this self ligation for all age groups, be it adults, be it children. And yes, in adults we do take the support of IPR. IPR means interproximal reduction, in which we take our inter IPR strips and we just strip the teeth by as less as zero point 0.2 to zero point 0.3 of a millimeter. We are able to get the required space, and again, we don't need to extract. So, with this, the non extraction therapy or the non extraction treatment for orthodontia is really gathering momentum. But I would still advise that if parents and children would like to take advantage of the fact that they could be suitable candidates for non extraction, then you have to remember that you must go to your orthodontist as early as 10 years. Only then the orthodontist can institute these things, although we are doing expanders and all kinds of appliances even in the adults, but it's more time consuming as compared to the children. So I would be happy to take any, yes. So there is a question that does the aesthetic profile get better without the extraction? Yes, it does, because we have already done the profile analysis. We have done all our cephalometric tracings. We have created simulations so that the profile with non-extraction becomes as good as with extraction. So I've just got a question that somebody has a gum infection, and is there an alternative to not pulling the tooth out? Is there a treatment? Yes, there is a treatment. We need to do an X-ray. We need to confirm and see that what is the treatment to be done, and not necessarily that we need to remove the tooth. Another question that has just come up is that somebody got the braces and the dentist did pull out my teeth, and the person is asking that will it have a negative effect or will my face get ruined? Well, we'll have to really see, and we could work out a situation where we could not have an adverse effect on your profile.
Somebody is asking that if the profile has become narrow and sunken because of extraction in the past, can you?
Yes, if somebody's profile has become narrowed and sunken, there is a treatment to fix it. One can do orthodontic treatment again, in which we would expand, we would get the arches back to normal, and we would try to do a dental expansion as a camouflage, and the profile of the patient would become as prominent as can be. So with this, well, another question which has come out is that somebody got braces, and will it have a negative effect, and can't it be moved back to its original position? Well, if the dentist has decided to remove your premolar, there would be a definite reason for that, and you could always explore the opportunity of coming to people or coming to orthodontists who do more of non-extraction treatment, and they could do your analysis, and they could come to a conclusion wherein can they do the treatment without extraction. So that could be the philosophy. So with this, I end my webinar, and I hope it has been informative for all of you. We would be ready to take up any questions, and if you would like to come over to Dentum and show us, we would be ready to answer all your queries and try to give you a painless and possibly a non-extraction treatment. Thank you.